Okay. The next is arbitrator externus, whose origin is the external surface of the arbitrator membrane and anterior bony margins of arbitrator foramen. The insertion is the posterior medial surface of the greater trochanter of the femur. Um, its action is to rotate the thigh laterally, and it also helps abduct the thigh. Intervention is by the posterior division of the arbitrary nerves and innervates most of the abductor magnus, vertical or hamstring portion of innervated by the tibial nerve. So I guess that's very complicated and also very important. Arterial supplies the arbitrator and medial circumflex femoral arteries. Next muscle we're going to talk about is the gemellus inferior. The origin is the posterior portions of ischial tuberosity and lateral arbitrator ring. It's inserted at the medial surface of the greater trochanter of the femur, of course, in common with arbitrator internus. Action, it rotates the thigh laterally and it helps abduct the flexed thigh. It's innervated by the nerve to the quadratus femoris or nerve to the arbitrator internus or both. The arterial supply, inferior gluteal artery, and next we got the arbitrator internus, whose origin is the internal surface of the arbitrator membrane and posterior bony margins of the arbitrator foramen. Insertion is the medial surface of greater trochanter of the femur in common with the superior and inferior gemelli. It rotates the thigh laterally and helps abduct a thigh when it's flexed, just like the ones we've talked about. As you can see in the pictures, they attach from, I wouldn't say similar places, but they are very close to each other. One of the insertion places, it is at the thigh. That's why it helps it rotate it as it pulls towards it. It's important to know. Okay, next we got quadratus femoris, whose origin is the lateral margin of arbitrator ring above the ischial tuberosity. It's inserted at the quadrate tubercle, an adjacent bone in the interocateric crest of proximal posterior femur. Action, it rotates the hip laterally and also helps abduct the hip. Right? Intervention is the quadratus femoris, branch of the nerve of the quadratus femoris and inferior gemellus, so L5 and S1, and not more than that. Arterial supply is the medial circumflex femoral artery inferior to the gluteal artery, first and fourth, perforating arteries, arbitrator artery, and some superior muscular branches of the popliteal artery. Okay. Next, we've got the posterior compartment of the thigh, and that is posterior. We know is our hamstrings, and then we have our biceps femoris, so the long head, right? So its origin is the common tendon with semitendinous from superior medial quadrant of the posterior portion of the ischial tuberosity. Its insertion is primarily on the fibular head, also on lateral collateral ligament and the lateral tibial condyle. Right. Action, it flexes the knee, and it also rotates the tibia laterally. Long head also extends the hip joint for how long it is. It's innervated by the tibial nerve, and the arterial supply is the perforated branches of the profunda femoris artery, the inferior gluteal artery, and the superior muscular branches of the popliteal artery. The biceps femoris and the short head, origin to the lateral hip and the linea aspera, the lineal supracondyle ridge of the femur, and the lateral intermuscular septum of the thigh. Insertion is primarily on the fibular head and also the lateral collateral ligament and the lateral tibial condyle. Its action are to flex the knee and rotates the tibial laterally. The long head also extends the hip joint, um, innervated by the common peroneal nerve, and the arterial supplies perforating branches of the profunda femoral artery, inferior gluteal artery, and the superior muscular branches of the popliteal artery. See you next.